It's 3 a.m. On a quiet street on the outskirts of town, a 26-year-old black mom calls 911, frantic because she thinks there's a break-in. But when cops arrive, they yell and throw her to the ground, thinking she's the suspect. And then across town, another 26-year-old black woman, 6 months pregnant, is wheeled into the emergency department, panting between contractions and bleeding. You see, the premature labor that she's going into was missed last week at her doctor's appointment when they dismissed her pain as, oh, it's nothing to worry about. You'll be fine. When it comes to these two scenarios, it looks like they have nothing in common, totally unrelated. But what they do have in common is that these two women are entering systems, healthcare and law enforcement, where in America there's been historical racial bias as well as misuse of power against communities of color, which has led to breaches of trust and waste of both money and life. And when it comes to racial injustice, professionals in these two fields, healthcare, symbolized by the white jacket, and law enforcement by the blue uniform, have similarities. They're both close-knit, with a culture of looking the other way. And when criticisms are raised, they tend to become defensive and put up impenetrable walls, one blue and the other white, to hold themselves and their professions unaccountable. But you know what? Where there's shared similarities, there may also be shared solutions in bringing these walls down. But first, before we explore them, I'd like you to take a good look at the people sitting around you. I want you to realize that you all are 99.99% genetically the same. You see, race isn't real. It's just a classification system that's not based on biology, not based on genes, and it's totally made up. And so the unequal results that we see in society related to race are not created by our biology. They're created by our social systems. Let's start with the premise that all lives do matter. Well, if some lives are being routinely and preventably lost as if they don't, then a major change is needed in our systems so that our outcomes match our rhetoric. So come with me behind the blue wall and the white wall so that we can understand what these similarities and shared solutions might be to bringing them down. We'll start with the first similarity, unconscious bias. It's probably the one that popped in your mind first. Those prejudiced thoughts that form without our direct knowledge and often contradict what we say we believe. Unconscious bias goes deep. Studies show that children as young as 4 years old, regardless of race, show bias in favor of white people. And when those children grow up to be adult professionals and have to make split-second decisions under pressure, studies again show that it's the unconscious bias that tends to win out time after time. What does this look like in healthcare? Well, let me share my personal story. Not as a doctor, but actually as a patient, because you see, I found myself in the emergency department at 3 a.m. I had had an accident a few days prior that left me with really severe neck pain, so much so that when I tried to lie back, I felt like I couldn't breathe. I didn't take the decision to go to the emergency department lightly, trust me, because let me tell you a secret. Doctors never want to be patients. So when I was there, the doctor examined me, gave me pain medicine, sent me off to radiology, which he ordered the wrong study, by the way. And when I came back and the results were back, he sent me home with sedatives. You see, he thought that my problems breathing were anxiety. Sure enough, when I got the right radiology study, 24 hours later, I was whisked off to emergency surgery to remove a huge blood clot on the inside that was pushing on my windpipe, all from a torn neck muscle. Well, you say, medical misdiagnoses can happen to anybody. Just look at the TV commercials. You'd be right. But healthcare interactions in which people are talked down to instead of with, ignored and disrespected, happen far more often to people of color, and with worse outcomes. You don't have to take my word for it. Just look at the medical literature. There are several, actually scores of examples. I have 3 listed here. Black people are more likely to be undertreated for pain, under-referred to specialists, and fail to get life-saving treatments, far less often than whites do. But what about unconscious bias in law enforcement? Well, it's a lot less studied. But what we do know is that every major uprising in the United States in the last 50 years has had something to do with protest against racial bias in policing. Starting with Watts in 1965, all the way through to Baltimore, 2015, with the death of Freddie Gray. And of course, we know the human stories. George Floyd, Patrick Lyoya, and 26-year-old Breonna Taylor. Behind the statistics that unarmed black people are killed 3.5 times more often than whites, and that black women are disproportionately killed in their own homes. Now, we know that the roots of this go to the next thing that I'm going to talk about, which is power and trust. The next similarity between healthcare and law enforcement. So we know that professionals in both of these areas are really admirable people who are essential to society, and they went into their chosen professions so that they could be of service to the public. But doctors and policemen have a tremendous amount of power within the interactions that they have with the public. And so the public has no choice but to trust that they're going to exercise that power fairly. And we know that the roots of that mistrust go deep, as well as the history of the misuse of power. From the 100 plus years of cruel medical experimentation that happened to black people and other communities of color, to, on the policing side of the street, the slave patrols, which after emancipation morphed into arresting black people for the slightest of infractions so that there could be a continued source of free labor, that loophole under the 13th Amendment. And so this has left an indelible stain of distrust in these communities that were affected. And we see that compounded today with present experience when we look at statistics like 7 in 10 African Americans feel that the healthcare system is biased when it comes to race and ethnicity. And then we're also seeing it in policing. 4 in 10 African Americans feel that race plays a role in traffic violations when they're stopped, and also other interactions with police. So there we have bias as well as power and trust. Let's move on to the next similarity, which has to do with waste. And I mentioned waste before, the waste of lives. But there's also the waste of money. Racism is extremely costly to the United States. We see this Wall Street Journal article from 2020 which cites that the top 20 police departments have paid out over $2 billion having to do with alleged civil rights wrongdoing. And on the healthcare side of the street, we have Johns Hopkins researchers that have calculated that healthcare inequities cost U.S. taxpayers over $135 billion per year in premature death and lost productivity. So there we have bias, power, trust, and waste. Those are the similarities. Now, what about those shared solutions? Let's see if you agree with me. Let's start off with bias again. So efforts to put communities in closer touch with the professionals that serve them are a great start. For example, we have George Washington University's Rodham Institute that matches medical students with members of the community from underserved areas in DC so that they can better understand their lived experiences. These are a great start. But we know from those 4-year-olds that unconscious bias goes deep, so it can take years to get rid of. What we need is a solution right now to safeguard people against the effects of unconscious bias. I've been privileged to be able to participate in such an effort in the state of Maryland, where the Maryland Patient Safety Commission has developed a curriculum that's training healthcare professionals in how to spot and call out unconscious bias when it's in the care, it presents itself in the care of Black pregnant women who we know need to be protected because they're dying at 3 times the rate of white women. And then another, that's a training guardrail. Another process guardrail happened in Oakland, California, when their police department said, you know what? We're going to have our officers answer a simple yes/no question. Is this traffic stop intelligence-led? And you know what? It caused the number of Black motorists who got stopped to drop by 43%. And far from making the city more dangerous, it actually led to drops in crime. And then we have our next solution, data. Without data, it becomes just a he say, they say situation. And the voices of the powerful and trusted drown out those of the vulnerable communities that they serve. We saw in COVID-19 that data was what clued us into the fact that communities of color were dying 3 times more from COVID than whites. But you know what? The reporting of race and ethnicity data is totally voluntary, if you feel like it. So what that's leading to is that the COVID-19 database, for example, is only 70% complete, and the FBI use of force database, only 40% complete. Making race and ethnicity data reporting mandatory is essential as a check against that power imbalance that I talked about so that we understand how communities that are potentially vulnerable are faring within these systems. And then the next solution, accountability, individual as well as system. On the individual level, that's known as the bad apple approach. And we have some of that in healthcare. You know, doctors have licenses, it can be revoked, doctors can be sued, and if they're causing the malpractice insurance premiums of the hospital they practice at to go up, they can be rooted out. Meanwhile, Derek Chauvin had 18 complaints against him before he even encountered George Floyd. So maybe it's time that $2 billion bill that I talked about be paid by police department insurances. That might motivate them to root out the bad apples by supporting accountability checks like allowing police officers to be sued, or working closely with civilian oversight boards, or making sure that there's a state registry for police misconduct. And so that's individual accountability. System accountability. How many people knew that doctors and hospitals now are going to be paid based upon whether their patients are getting better or not? It's called accountable health care. And it's leading to a lot of out-of-the-box solutions by answering questions like, are the people we're caring for getting better at a lower cost and a better experience of care? Well, what if we ask those same questions in policing for police system accountability? Are the neighborhoods that we're policing and keeping safe getting safer at a lower cost while we lock up the minimum number of people? So that's accountability. And then finally, evidence-based approaches as the last solution. So this just means rather than erecting walls and becoming defensive, what we do instead is look for what works, change our behavior and policy, and just go with that. So let's go back to that 26-year-old mom in premature labor. Studies show that if she had used a trained pregnancy companion called a doula, that both she and her baby would have been safer. The problem, though, is that insurance companies don't want to pay for doula services, and doctors are resistant to bringing on doulas as part of the healthcare team. And in policing, we're seeing that instead of police being called out to address mental health crises, you know what? They're using social workers and medics in many cities across the United States. This is leading to fewer people getting shot and locked up. And in cities like Eugene, Oregon, they've saved $8.5 million in policing costs. Change. That's what this all boils down to, the courage to change. So that at 3 a.m. or any other time of day, those moms that we talked about can be as safe as anybody else. But you remember the dinosaurs, right? The last time they met, they voted not to change. So that the dinosaurs' fate is not our fate, let's change. Let's embrace the changes to put guardrails against unconscious bias, to bring in data and accountability, and to compassionately bring in evidence-based approaches that are going to lead to behavior change. Because that is the way to break down both walls, the blue and the white. Thank you very much.